Hello everyone, my name is Dr. Priyanka Saokar. I am owner of World Class Dental Clinic which is located in Pune, Deccan. So today I am going to talk about cavities, why we get cavities and whether we can prevent it, what are the signs and symptoms when we get cavities. So first thing I want to tell you, there is basic structure of our tooth. The outer layer is enamel, the inside layer is dentin, and below that there is pulp. This is the basic structure of enamel. The outermost layer is the hardest structure, that is enamel. When we bite food, all the teeth coated surface, that is known as enamel. Below the enamel there is dentinal layer. It is a tough surface, but it has some bending capacity. Dentin structure is just like a bone. It has some neural canals are there. Basically it deals with the how both of the layers have formed. Like enamel formation and dentin formation, there are some basic differences. When enamel formation occurs, the cells of enamels, that is known as ameloblast, they form enamel and they grow outwards. Okay, so the outer layer of enamel, it has those cells and it wears off. So basically enamel don't have regenerating capacity. When we consider the dentin, it is the inside layer. The development of dentin happens exactly in opposite direction. Suppose enamel layer, the cells are going outward and the outer surface there are ameloblast, and eventually there won't be any cells which have generated enamel, right? Dentin, exactly different thing happens. Suppose this is a dentinal layer, the cell will deposit the dentin and it will go down and it will be stored here. So dentin has some regenerative capacity, and below the dentin there is blood supply and nerve supply of tooth, that is known as pulp. So why it is so important? This pulp contains blood supply and the nerve supply, and dentin has some I will say tubules. It has some fluid. So basically slight amount of sensitivity when we feel, when we get cavity, it is because of the dentin, that fluids, and there is nerve endings below that. So it is slight amount of vitality is there in dentin, and even the regenerative capacity is there in the dentin. Now we'll move ahead with the topic, why we get cavities. What is the basic phenomenon why cavities occur inside our mouth? See, for cavity to occur, there are two important things. One is a food stuff, or the stuff we eat, or something where which can be digested by one organism, that is a bacteria. These two things are needed, some substance and the bacteria. Bacteria which causes cavities are known as Streptococcus mutans. Okay, and they grow on mostly on carbs. Okay, like we can say vapors, sugary food stuff, starch. Okay, so that structure is required. Those food stuff, even they grow on cell debris inside our mouth or some mucus. So basically what the bacteria do, they try to digest those things, try to digest those carbs. While doing that, they generate some acid, lactic acid. Once that acid is generated, though bacteria survive in that acid, but our enamel can't. The enamel demineralization start. The outer layer of tooth, that is known as enamel, slight amount of demineralization start. If we neglect it, if we don't flush out those bacteria, that food stuff outside our mouth, and continuously repeating same habits every day, every night, not brushing our teeth, those bacteria accumulate inside our mouth. They do the same chemical process on the food stuff that whichever left over inside our mouth, and try to digest that food stuff. It will create acid. There will be more damage to enamel. As we know, now just now I've told you, the ameloblast which is already gone, enamel doesn't have regenerative capacity. What we get is cavities. Okay, the outer layer of enamel, as it is not having blood supply, nerve supply, you don't feel anything when you are getting cavities. How the earliest stage of enamel, when there are cavities, how it will look like? It will be just a white spot, white demineralized enamel spot will be there. That is the beginning of your cavity. The more it will get demineralized, it will become brown, black, because bacteria and foodstuff get accumulated into, and it will give more dirty appearance. When you will feel that something is going wrong with your mouth, inside your mouth, at the time when the infection will reach to your dentinal layer. Once it reaches to your dentinal level, at some extent you don't feel anything, but once it start going deeper and deeper near to the pulp chamber, as I told you, dentin has some tubular structure, there is fluid. That time, that neurons start feeling sensitivity to hot foodstuff, cold foodstuffs. There is sensitivity while you are sitting and breathing air. That time you feel something is going wrong with my tooth, and that's the moment you notice there are cavities, or you go to the dentist. So this is the basic procedure. Some people neglect at that time also. If they are getting sensitivity, oh it's okay, they start using something, but they don't focus on oral hygiene, don't go to the professional opinion. What happens next? The infection goes deeper and deeper. It goes into the pulp, which is the blood supply and nerve supply of the tooth. The moment it reaches to the pulp, you will get sharp shooting pain while having hot and cold foodstuff. That is known as acute pulpitis. Acute pulpitis, most of the time it is compared with the labor pain also. The pain is so severe that patient will not even focus on any work, because it will be sharp and shooting pain. Okay, but few patients, they are able to manage and neglect that pain too by taking some analgesic and all. If they continue doing that for this period of, I will say, 2 months or 3 months, neglecting in, the frequency of pain will decrease. What will happen next? Next, the infection will go into the pulp chamber. It will damage the pulp thoroughly. The blood vessel will die with the infection. Then the neurons will die, because there won't be any type of pain, and that moment your pulp will be dead completely. You won't feel anything, because there is no vitality left in your tooth. What will happen at that time? Patient won't feel any pain, but the tooth structure, it will be like porous. There will be totally damaged tooth structure left, and this patient, most of the time, they complain while chewing food, I broke my tooth, because it was there, infection was there since beginning. You have neglected for such a longer duration that now it has gone inside your tooth, it has damaged your pulp. What is next if you are still neglecting it? The infection goes beyond the pulp, and the apically, means below the roots there is bone, it start infecting that bone too. There are chances such patient develop big cyst below the gum, below the roots. Suppose this is your tooth structure, okay, this is the crown part and this is the root part. Below the roots there is a bone, okay, so inside that bone the cyst like structure will develop. Okay, so that is the next stage. Then patient will have, once that cyst develop, obviously the bone is like again the some sort of soft tissue, means though it is hard, but it has ability to expand because of such cyst, it will expand. Then patient will have the swelling here, the extraoral swelling, the part of the tooth which is infected, near that part it will swell. Even sometimes if you are neglecting that point also, it might go into the spaces. There are certain spaces with the muscles, so once that infection is neglected, there are chances it may spread more rapidly into the other parts. So this is the phenomenon, how the decay starts, how it affects the enamel. If you are neglecting, it will affect the dentin. If you are still neglecting it, it will affect your pulp chamber. If you are still neglecting it, it will go into the roots. If you are still neglecting, it will go inside the bone, it will form a cyst, then you will get this intraoral swelling. If you are neglecting it, you eventually will get extraoral swelling. That is the whole phenomenon from one small cavity and how it will proceed. The next part I want to explain, what will be the treatment. What will be the treatment for such a problems if it is occurring inside your mouth? I will go step by step. First, what we should do so that such problem or cavity should not occur inside our mouth. The first thing, you should brush twice. Why twice? See, basically when we sleep, it is 8 to 9 hours sleep, right? There are total 24 hours. We have to understand the bacterial cycle also, digestive systems also, and the amount of acid is generated for amount of time it is staying on your enamel, it also matters. Suppose I am brushing only in the morning, right, but I am not fasting throughout the morning up to the next day morning, I am eating something in between, right? So whenever I am eating something, the streptococcus mutans are already there. So the moment I eat like chips or sabji or anything, that time after I finish my lunch, on those food particles this bacteria will act, then they will generate some lactic acid. That acid will stay inside my mouth. The overall environment will be very acidic. If I am not brushing in the night, that acid will stay, and night there is one bad thing, we don't even swallow. Means sometimes it might happen during daytime, we eat something but we keep swallowing things, like saliva is there, we keep drinking water. But what about the night time? We are sleeping for 8 hours and we are not drinking water in between every hour. So that acid is staying inside our mouth for longer duration. So chances of cavity are more with the people who are brushing once. Twice brushing, morning when you get up, the overall night whatever acidic content was there inside your mouth, you are shedding it off by brushing properly. Okay, after that you are having food, lunch and all that stuff, but you are drinking water. Night hours before going to bed, again you are brushing your teeth, you are removing all the dirt inside your mouth. So overall when you are sleeping, that time some toothpaste residues will be there which contains fluorides. Most of the toothpaste contain fluoride, calcium, other minerals. Even the if patients are using mouthwash after the lunch, it contains chlorhexidine, again it has antibacterial property. All these minerals are there. So night when you are brushing, that residues from the paste will be there inside your saliva. So overall within a span of 8 hours there won't be much bacteria and the acid production inside your mouth compared to when you are not brushing your teeth. So chances are cavities are reducing. Along with the brushing twice, one more important thing, you should floss your teeth. So flossing, it's not a rocket science, it's not an alien thing. You have to just hold that floss. It is available in every medical. Just twist it around your finger and press it down the areas where food is getting accumulated. If you feel that certain part of your mouth, like the molars, between the molars and food is getting accumulated very frequently, try to clean that area first with the floss. No need to floss all around your mouth, okay? Only those parts where food is frequently getting accumulated, try to keep it clean with the help of flossing. Second thing, as we are covering our mouth, like morning we are brushing our teeth and the night we are again brushing our teeth, but there is total gap on almost 14 hours. What about after the lunch thing? After the lunch, if it is possible for you, you can carry a small bottle of mouthwash. Try using mouthwash after your lunch and don't eat anything for at least 20 minutes. So it has antibacterial activity. It will try to clear out that acidic content from your mouth and it has antibacterial activity, so again it will clear out the excess amount of bacterial load also, so it will prevent cavities. Apart from this, what else you should do to prevent cavities for kids? Like when their teeth erupt, permanent teeth erupt, we have fluoride application things. Even for adults we do sometimes, like post braces also we do that. What is fluoride application? See, nowadays most of the government, most of the countries, they are adding fluoride to their normal drinking water. Why they are adding it? Because fluoride is one important stuff which will prevent the cavities, which is important to maintain your oral hygiene. So if you are applying that fluoride, we are giving a higher dose of fluoride by coating your teeth with the fluoride, kids kit with the fluoride. If we are doing this every year once, there are very good chances we are giving maximum protection against the cavity generating bacteria, because the outer layer of enamel uses that fluoride to become very strong, to get more mineralized, so that this bacteria, whatever they are producing acid, it will be less effective on your teeth, on your enamel. So fluoride is important. So fluoride application, there are multiple things into it. In-house application can be done and in office application can be done. There are certain trays where you have to just put the fluoride and put inside the mouth, keep it for 15 to 20 minutes, and it will give the one sufficient dose of fluoride to your kids' teeth or your teeth. Same can be done in office fluoride application technique, where we coat the teeth surface, all the teeth surface, then we floss so that it goes in between all the teeth, and we keep it for 15 to 20 minutes and fluoride application is done. It is a painless procedure, no local anesthesia is required. Nothing is needed, means totally painless procedure. Hardly the procedure is done within a span of 45 minutes. So that is the rough duration what it takes to give anti-cavity treatment. So that is one important measure that will prevent the cavity. Apart from this, third thing will be diet, food habits. Try to minimize the sugar intake if it is possible, carb intake if it is possible. Anyways, carbs and sugars are not good for our health in a large quantity, so try to minimize it. Where we can't minimize this, there are few cases we can't minimize it, like in kids, they have a habit of adding sugar to everything, right? Night before going to bed they add sugar to their milk, and they have a habit of eating chocolates. Now what to do? You can't force them every time to brush their teeth. That time do only one simple trick. Allow them to eat whatever carbs they want to eat, but immediately after that give them some salad, at least piece of cucumber, carrot or something fibrous, so that they will bite on it, and the molar surfaces which has too many grooves, and suppose they had chips and it got accumulated on the teeth surface, immediately after that you are giving them a piece of cucumber, they are biting on it, the starchy potato chips, whatever stuck on the tooth surface, it will go off. That will help them to develop healthy habit. Though we are not restricting their food habits, we are preventing the cavities by monitoring their eating habits mindfully. So and that is one thing. Apart from this, to prevent decay, I will suggest for this newborn babies or 6 months or lactating mothers, most of the time what we do, like after feeding our baby, we totally forget to clean their mouth. At the age of 6 months, first tooth start erupting, so that time you should do one thing: have a gauze piece or cotton piece and try to clean that first tooth which is erupted in their mouth immediately after feeding. Why it is so important? Because the breast milk Even the formula milk, whatever we are providing, it contains lactose and it contains sucrose too. So both are the deadliest combination for this streptococcus mutans to grow, to feed on, to generate that acid. So we have to prevent that, because nursing bottle caries is one of the most common type of caries in kids. So if we don't want, at the age of 3 our kids are having all cavity in front teeth and everywhere, we have to monitor these habits. Age of 6 months we have to start taking care of their teeth. Avoid giving milk and sugar as their last meal. If you can't avoid it, at least give piece of cucumber or something fibrous to eat, or ask them to brush their teeth. So by this way you can prevent those cavities. And another thing, if we can't prevent those cavities, what is next, what is the sequence, how it goes? So we'll learn step by step: enamel, dentin, pulp. So now we have to go follow the same sequence. Now we are preventing cavities totally by taking this precaution. What happens if you see the white spot? That means cavity, the demineralization has started. The moment you see that white spot or blackish discoloration of on your teeth, you should go to the dentist, get that cavity filled. There are very nice material, they look exactly like your tooth, and they will prevent the further progression of that cavity. Now if the cavity inside the dentines and you are not feeling any sensation, the treatment is same. But what if it is near to the pulp and you have slightly started feeling hot and cold sensation? That time what we do, we perform a procedure called IPC, where what we do, we try to remove all the cavity and we give a medicament below, and on that we fill the temporary filling material. We give the patient waiting period of 6 to 8 weeks. In that period, because of the calcium content what the medicament we have given, that dentin remineralizes again and it erases those caries, erases that sensation of hot and cold. And then after 2 months we remove this temporary filling material and fix your tooth with the permanent filling material. So it is done. But what if the infection has gone into the pulp, you are getting severe pain? That time your tooth undergoes the procedure called root canal treatment, where we actually take out the blood supply and nerve supply of the tooth and try to fill it with bioinert material, gutta-percha, and that procedure is known as root canal treatment. What if the infection is gone beyond the roots? We do the same procedure, but it is in multiple steps, not doing in a single visit root canal treatment, but we take 4 to 5 visits so that apical infection resolves. If this is are quite big and it can't be drained out with the opening of tooth from the RC opening, that time what we do the apicectomy, where we try to cut small portion of your root, okay, and we try to enucleate the cyst, where we remove the cyst border and everything, so that again that cyst should not occur inside your bone. And what if there is too much of extra oral swelling and too much of infection and your face is swollen? Exactly same procedure we do, but we give higher antibiotic, higher analgesics to control the infection first, and then we proceed with the enucleation of the cyst along with the apicectomy, followed by root canal treatment. So all these procedures are done to for the patient where the cavity has occurred, and for the patient where the severe infection below the root has occurred. Hope this video have helped you to understand what is tooth structure, basically how it forms, what are the parts of the tooth, how the cavity occurs, and how exactly the progression of cavity occurs, and what are the treatments stepwise, prevention, interception and correction for the problems you got. Thanks for watching. Bye bye, take care.